Let's bring in my good friend, Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center, with us this morning. Good morning, Dr. Joe.
Hi, Ray. How's it going today?
Not too bad at all. High humidity and high heat. I'm one that kind of likes it, but I know in the world of sports medicine can be a little dangerous. That's for sure.
It can, and you've been saying, but it makes it feel like a real summer when you go through some of that heat and humidity. So I'm kind of with you. We are having, I think, a pretty good summer, and we're trying to keep kids safe out there. But now it's go time. I mean, they are the fall sports kids are getting ready to roll. And I was going to talk about a real important person on our sports medicine team, important group, and that is the sports physical therapists. There even is specifics of pediatric sports physical therapists. And I wanted to talk about three of the different techniques that I get asked about a lot that they use to get athletes better, that are newer things in the last couple of years. For a long time, a lot of years, and still in a lot of places now, the treatment of sports injuries is basically just rest and wait for the injury to kind of try to heal itself, and or even go back out and play, and in many cases that makes it worse. And so this very important team of players on our sports medicine group is sports therapists. They do a thing that we call kind of a full court press. These kids work and play all year long for this 10-week period or 12-week period, and so they want the best of their care too for sports medicine. One of the things that you saw a lot in the Olympics is different types of taping that has been out there in the last several years. And the two that I was just going to mention today, they're slightly different, is the kinesio taping is that really bright colored tape, and that is used, it can either inhibit a joint from moving too far in a direction, or it can actually activate a joint that's too stiff to get it moving. It's really important, though, that it's applied appropriately and in the right position, and so that's where they do a lot of training in kinesio taping. But you'll see in long muscles like the hamstring or the calf muscle, certainly during the Olympics we saw a lot of kinesio taping. The other thing kinesio is really good at is reducing swelling early on. So a lot of people go back to their therapist the first week a few times and end with some good taping to really do a good job reducing in the joint, reducing that swelling so they can start to heal and move in the right direction. The other type of taping is called functional taping or dynamic taping. That's a thicker type of tape that's used more to take the place of a ligament or a muscle tendon that's torn or stretched. And if people are just a little bit weak and they need to be augmented a little bit, supported a little bit, they use this tape. Because some of it actually looks like tattoos, but it's a thicker taping. And a lot of people were asking me on the Olympics about the difference between functional taping and kinesio taping. These are two things that therapists use, and they really have to be pretty well trained in using these things to help athletes. Number two, at our place, really working very well in the last year or two, is that our therapists are using an app that they give kids the first time they come to physical therapy on the phone. You know that for a lot of these kids, they really can only go to PT maybe twice in a week, but we want them doing their exercises every day. So on the app, they will actually give them video footage of what exercises they want them doing in the next 3 to 5 days until they get a chance to see them again. And then when they see them again, they will update and individualize these programs. But I know these apps are really an exciting addition to the sports physical therapy realm. I'm even using them on a couple of exercises that I'm doing because you kind of forget what they told you or how to do them, and these video apps are very, very helpful. I have patients all the time coming in saying they love the video app. The other thing that's kind of cool about it is you can see if the athlete is compliant or not, if they're doing their exercises. If there's nothing done on the app, you know that they really haven't been compliant, and then, hey, maybe there's a reason why they're not getting better. So these apps are really a cool addition. And the third thing, of course, is telehealth has been used so much since the pandemic for so many things in medicine overall. In sports medicine, it's allowed us to increase our footprint of getting to more athletes. So a lot of our athletes come from an hour and a half away. They don't have ready access to pediatric sports physical therapy, which is so specialized these days, so that they will come for a visit and then maybe have a telehealth visit or two, or they'll come for 2 visits, get a telehealth to get updated. And so a couple of techniques are all these different types of taping that can really help with injuries, an app that can keep people working every day so that they're getting better with a full court press to play as soon as they can, and telehealth are 3 newer tools in pediatric sports physical therapy that are really helping our athletes get better, quicker, and back out on the field sooner.
There you go. The story of the people that all make it work. Sometimes we all see the finished product of the young athletes and might not know the story that goes on and making sure that they're as efficient as they possibly can. Good story, Joe. Great information. Thanks for the visit, my friend. We'll do it again next week.
We'll see you soon, Ray. Thanks.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us this morning.